What to expect after ACL surgery, brought to you by Knee Rehab Pros and KneeFit5.com. So after you've had an ACL reconstruction, your knee is going to be stiff and swollen again, just like it did after you tore it. So the rehab starts in my patients right in the recovery room. What do we work on? We work on getting your knee all the way straight. We work on getting your quadriceps to wake up, and we work on getting your knee to bend. Essentially the same type things that we did right after you tore your ACL when you initially presented. So people can bear weight as tolerated. Most people need crutches for a week or two. The surgery usually lasts about an hour and a half or 2 hours. And again, the rehab starts right in the recovery room. I also work on trying to minimize the swelling. So I put an ice compression device on the knee. I use compression on the knee. I try to keep it elevated to keep the swelling down, and have them perform their exercises 4 times a day. Most people need crutches, like I said, for a week or two. So after the first couple weeks where you're working on motion, quad control, swelling control, what happens next? Well, then you usually start progressing with strengthening activities and more repetitive things like cycling and those sort of things. It's usually okay to start those around 2 to 4 weeks, depending on how your motion is. The tricky thing about knee rehab is if you're still stiff with your bending, so stiff with your flexion, and you start working on other things like strengthening or cycling or walking or jogging, then it becomes much more difficult to get your bending back. So the hierarchy of things to happen after an ACL reconstruction is first get your extension all the way back, get your quads to wake up, and then get your bend. Once your bend is over about 130 degrees or so, then you can start the cycling and strengthening. So when can people do higher level stuff like jogging after an ACL reconstruction? Well, it usually takes about 4 to 6, maybe even 8 weeks for the flexion to get high enough, and B, to get the strength back enough to start jogging. It's okay to try jogging earlier, but it will usually feel a little bit awkward until your strength and bend is a little bit back. But after you're able to start jogging, then you're able to start sprinting. So a couple weeks after jogging, then you can start sprinting, and then you can start practicing stuff, cutting out stuff and stuff like that by yourself. People run the risk of re-injuring themselves when they're back playing again. So the early rehab stuff, the jogging, sprinting, strengthening, all that kind of stuff, really is low risk for re-injuring your knee. It can happen, but it's very low risk. If you liked this video and found it informative and would like to have further information, please check out our YouTube channel, as we have many informative videos there. Please also subscribe to our video channel, and you'll get weekly updates with new information.